topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, San Antonio. Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. Hey, today is a very special day for Medicare. We are so lucky. We got the top Medicare agents in San Antonio. Listen to this. What a great name, Medicare Gals, the signature team. Let me welcome you to Susan Ship. Good morning, Susan.
Good morning. How are you?
I'm good, but are you ready for today?
Today's going to be nuts. It's the day that everyone can start their enrollment into Medicare, change their plans, and all that fun stuff.
Well, the reason I am so excited about this show, first of all, you've been asking us to do a show on Medicare for the last 4 years. We just haven't had an opening. But I got to tell you, I'm on Medicare, kind of showing my age, and I made so many mistakes that were costly to me. And I don't want you to make the same mistakes I made. You know, for you people who are new to Medicare, this is the greatest show to be watching or listening. Susan, tell us about your company.
So, we are a team of Medicare insurance experts, and we are passionate about helping people. Medicare is so confusing to people, and I know you've been through the confusing part. And, we just are there to educate and lend a helping hand to those who just are very confused because you get so much stuff in the mail, on TV, and you're like, what's right?
Yes.
What's wrong? And you want to hear it from someone who's licensed, local, and trusted. And that's what we do. We are just a local resource in your community to ask questions, help with anything that you have going on, any issues, and help with the enrollment process. And we become your patient advocate. So you don't have to call the insurance company. You call us because we can usually help navigate quicker than you getting transferred through the insurance company phone lines.
Susan, we started promoting your show several days ago, and the questions started pouring in. I tell you what people are confused about. All these national commercials and the robocalls
Yes.
and the things that they promise. A lot of these questions were some of the stuff sounds too good to be true. But if I'm correct, in Texas, it's different by county, isn't it?
The whole entire country is different by county. So that's the thing is what you see on TV may not apply to you based on your
Yes.
zip code and based on your county. So these are national campaigns and what they do is they want you to call that phone number. And so you call that phone number and they look up your zip code and they're like, "Oh, sorry, you don't qualify for that." But let me tell you what you do qualify. So they just dangle that, shiny little object and you
Yes,
fall for it, right? And then they switch
exactly.
you into a plan that's not even good for you. These are national ads. They are not local ads.
Susan, I got to say this because um, it was a big problem for me. Folks, it's so important that you get a good agent. And I'm going to tell you why. My first agent, Susan, was horrible. And what I mean by horrible is they basically showed me one plan when they could have showed me 6 or 7 plans. And then when my first year was up, they didn't even call me. They just assumed I wanted the same plan. And I have a good agent here in Florida now, but I know that customer service is so important to you.
Absolutely. That's one thing we pride ourselves with is we're not just one and done. We're with you throughout the years. We are constantly in contact with you. You get newsletters from us. You always know are in the know. When we find out stuff, you know. We do client reviews with you face to face or over the phone or via Zoom with you every single year. So right now I'm in the middle of a lot of client reviews. So we always are with you. We're not just, sign you up and then see you later. So we are always, always with you. And you call us. You have our cell phone numbers. You have our direct numbers that you can call us if you have any issues, any questions. So, that's one thing we do pride ourselves with.
Somebody wrote us in who actually called in with a question wanting to know about changes. And because of when the show was last month, you couldn't even divulge any of those changes.
Yeah.
What kind of changes are we looking for now?
So the Medicare premium is increasing. So we know that.
What's
That's every
new?
year.
Yes.
That's, and then there are changes to a lot of the plans. There are some insurance carriers that are pulling out of counties. The Austin
Wow.
area, San Antonio area, Waco area. I mean, they're just pulling out because they're not being profitable. So therefore, they are
Mm.
terminating plans. And if you're on one of those plans, then you might not be covered for next year. So that's why it's very important to read your letters, read that annual notice of change that comes out. And honestly, there are changes to a lot of like the Medicare Advantage plans and the drug plans, increased premiums, increased copays, reduced benefits. So there's a lot of changes you just want to review because what's good this year may not be good next year.
I got to tell you, I'm on Humana, and I got to tell you, this is the reason why you should check with your agent. 2 years ago, I got glasses. Did not cost me a dime. They paid
Yeah,
for exam, everything. I went in 2 days ago, and it was $170.
yeah.
So in 2 years it changed, but it shows that's why it's so important that you get a good agent because maybe the plan that was great for you last year might not be good for you this year.
100%. Yes. Yeah.
So, what are the key dates that people should remember for this year's enrollment period?
So today, October 15th, starts your enrollment process. Can meet with agents like me, and we can review your plan. And it runs through December 7th. So, you have about 9 weeks of time to do some enrollment. If after December 7th, you don't make a change, there is an open enrollment period, and those are for people only on Medicare Advantage plans from January through March that can make another change. So, but the key dates really are October 15th through December 7th.
I got something funny, and I spoke to my agent, and they said, you're going to be getting not a lot more, but a little bit more each month. It goes to my Social Security.
Yes.
What I didn't know is the rates went up. So it,
Yeah.
it kind of washed that out.
It's a moot point. You get your cost
Yes.
of living increase and then the Medicare premium increase, and it kind of washes.
What do you, just out of curiosity, we've heard the president talk about Pfizer, and there's another company just came out that are going to be reducing um, a lot of their products by as much as 80%. Will that occur this year?
No, no.
Okay.
So that's the thing is like everything's set in stone for 2026.
Okay.
It usually takes about 2 years for anything,
Oh,
any bill to kind of
wow.
come to fruition. Now the thing is 2027, they will start negotiating 2027 in February. So they start early. So right now, no, nothing has changed with the anything with President Trump with what he did. So, but it will come down later in the years.
Here's a listener from Bastrop. I don't
Yeah,
even
near
know that.
Austin. Yes, Colorado.
Bastrop, they said, I'm really enjoying your show. Thank you so much for bringing a show like this. Can you explain? I keep hearing plan A, B, C, and D. Can you explain what those are?
Yes. So plan Part A and Part B, that is your original Medicare. That is the red, white, and blue card that you get from the government when you turn 65 or when you enroll into Medicare. That's Part A and Part B. Part D is prescription drugs, D for drugs. And Part C is combining your Medicare A and B, which is hospital and medical doctors, plus your D drugs into one plan called the C. So it's A plus B plus D equals C. Medicare Advantage is what it's called. And it's just all your medical, your prescriptions, but you get additional benefits like dental and vision and hearing and free gym memberships. And some plans even give over the counter benefits where they give you money to go buy your, allergy medicine, ibuprofen and stuff like that. So that
Mhm.
is the C.
Well, that makes sense. I like the way you broke that down. That makes a lot of sense. A lot of people hear about Medicare Advantage and Medicare supplement plans. Can you briefly explain the difference between the two?
So the difference is how you get your care. So Medicare supplement plan is you pay a higher premium every month in addition to your Medicare premium. So, maybe $150 to $200 a month. You have a deductible that you have to pay one time per year. And then after that, everything's covered 100%. Now, that's kind of like car insurance. You pay it every month. You got to pay that every month. You may not use it every month, but you have that there just in case. Medicare Advantage is where you usually don't pay an additional premium, but then you pay copays as you actually use the services. So if you go to the doctor, you pay a copay. If you go to the pharmacy, hospital, you pay a copay. If you go to get an MRI, you pay a copay. So it's an as needed copay versus supplements pay ahead. So it's very confusing. A lot of people call Medicare Advantage a supplement, but it's actually not. It's called the Advantage Plan. Supplements are where you pay a little bit higher premium for coverage.
It's so important to have a good agent. I, Susan, I don't know if I would have had this problem in Texas, but with me, I really liked my orthopedic surgeon. So I
Hmm.
wanted to make sure that he was in my group, and he was.
Good.
But when it was time to use him, my provider said, "Well, he's not in our plan." And I'm going, "But here's his name." Well, but we have our own plan within the
Hmm.
plan. Have you
Yeah.
heard of that before?
Yes. So that's called a pod system. And so Florida, like Texas, has a pod system, and WellMed Medical Group is one of the kind of hands-on um, gatekeepers, so to speak, for some of the plans. So yes, even though a doctor may be contracted with Humana or United Healthcare, it depends on who your primary care doctor falls under. So there's umbrellas of medical groups, and if they fall under a certain umbrella, then they can refer to that doctor. If they fall under a different umbrella and that doctor doesn't reciprocate with that umbrella, you can't see it. So it's very confusing. That's where we can kind of navigate and say, okay, if you want to go to that doctor, you might have to change this primary care doctor. So it's complicated. Why they make it so complicated, it shouldn't be, but I think they just want to confuse people so that I don't know. So they don't get the care. I'm not sure, but that's where we come in to make sure that everything fits like a puzzle piece.
Here's Manuel in Laredo. First, he wants to know, do you cover Laredo?
Yes.
And the second question is it better to go with a large company versus a small company? Because I hear some of the small companies are either going out of business or pulling out of markets.
Well, that's a good question. And yes, I do cover the whole state of Texas. So Laredo, yes, I
Good.
can do that. But good question because funny you should say pulling out of counties because it's some of the larger insurance companies right now that are pulling out of counties.
Oh,
United Healthcare, Blue Cross Blue
wow.
Shield. Yes, the big names. And actually, the smaller companies right now are more stable. So that's the interesting
Unbelievable.
part. Yeah,
Gosh, that's amazing.
yeah.
Um, you know, I got to tell you again, folks. I give first of all, give people because there's a lot of people listening on radio and on Spotify and that don't see the YouTube scroll. Give people your phone number.
Sure. My phone number is 210-767-9876. And I have a team that if you call us, we can definitely assist you. It's and we're a free service. That's the thing is we don't charge you anything. So even if you're not sure or you don't have an agent, it's best if you just review just to make sure. Because you know what? If you go to the doctor or the pharmacy next year and they say, oh, that medicine's $400, you're like, well, wait a minute. It was covered last year. What do you
Right.
mean? It's because you didn't check.
Yeah, it makes sense. How do changes in drug formulas or network typically affect beneficiaries year to year?
So every year the drug formulary changes. What's on one insurance company may be different on the insurance other insurance company. Drug deductibles increase every year. So Medicare sets the drug deductibles, which is for next year $615. So if you have any high cost medications, what we look for is to try to find you the least expensive because if you have to go pay that $615 out of pocket the first time you pick up like an Eliquis or a Xarelto or a Trulicity, then you're going to be like wondering what's going on. So the drug formularies can change. What was on a tier 1 generic could go to a tier 2 or can take it off the formulary altogether. I've seen that already twice this year that fenofibrate, which is a generic, and a cyclobenzaprine, they're not on the formularies this year.
Is if someone is considering, say, switching from Medicare supplement plan to Medicare Advantage plan, what should they keep in mind before making that change?
So to keep in mind, there's two things. One, you have a Medicare guaranteed issue trial right. If you've never been on a Medicare Advantage plan and you want to try a Medicare Advantage plan to maybe save you some money, but still get the care and extra benefits, you have 1 year from January through December to try a Medicare Advantage plan. If at any time throughout that year you do not like that Medicare Advantage plan, you have a guaranteed issue to go back to that plan that you were just on. Guaranteed. They cannot ask you health questions. They cannot deny you. They have to
Mm.
take you back. So that's a positive. So you can always try it. And then, two, just know that with Medicare supplement versus Medicare Advantage, you want to make sure you're on a supplement plan, which is like a PPO plan, which means you don't have to have referrals. You would want to make sure you go onto a PPO plan just to have the same kind of flexibility you do on a supplement plan.
Susan, how do you keep up with all the different insurance companies and their plans?
Well, I've been doing this 11 years. So pretty much they stay for the most part the same, right? They just change their benefits here or there. But for the most part, it's embedded in my brain. I do this every single day. So I start to memorize all this stuff. And I can have clients call me on the way to have a surgery and they're like, what's my copay? And I'm like, and I tell them 250 and they're like, okay,
Yeah.
great, thanks. Then they get there and like, yeah, it's 250. So I just know all the numbers. I know all the plans. I know who takes what, how it's run, how to get all the information that you need.
Well, listen, I don't endorse any certain plan. I do endorse having an agent to help you with this. Like I said, I'm on Humana's Advantage Gold plan, and I got to tell you, I don't mind admitting things. Like if I snore, I'm on a CPAP machine, or if I'm losing weight, I'm on Ozempic. I got to tell you, with Ozempic, I was only paying $30 a month
Yeah,
out of pocket, which was amazing.
yeah.
And after 6 months, for the next 6 months, I don't
It was
have to
zero.
pay anything.
Yep,
Yeah,
you hit the catastrophic. Yeah.
yeah. And my CPAP machine, which they can get pretty pricey, it pays for that. So I got to tell you, I've had friends of mine who said they really didn't care for Medicare, especially the ones who are on HMO, where
Hmm.
you have to use a doctor. I got to tell you, the doctors I've used in my plan have all been wonderful. I
Yeah.
haven't had any bad experiences at all. Um, I noticed we got a question about HMO and PPO. Can you
Yes.
explain the difference?
Yes. So an HMO is a health maintenance organization. It's where basically your primary care doctor is kind of like your gatekeeper. They have to
Mm.
refer you out to your specialist and they have to be in the network. Okay. So you have to have authorization to go to your cardiologist, your dermatologist, the endocrinologist. So the primary care doctor is the person who manages all of that. The cost of HMOs are a lot cheaper. So you do have cheaper copays and a little bit more benefits on an HMO. You do have worldwide emergencies and nationwide emergencies, but you have to stay within your service area of where you live for your doctors and hospitals. Now, on a PPO, it's preferred provider organization, which is kind of like if you've ever been on employer coverage before. PPO is where you can come and go to doctors at your leisure. You don't have to have a referral. You can access doctors all across the country. There's an in network, there's an out of network benefit. So you are able to see doctors in and out of network. You pay a little bit more on an out of network benefit, but you have that flexibility. Copays are a little higher, and then you've got a little bit lesser benefits. But there's no wrong way. It's just how whatever your doctors are going to take and is best for you.
Susan, I must say, I totally understand why you were so successful. You were so informative. Your show goes by so fast. Bad news is you are going to be really busy.
Starting
The
today.
good news is you're going to be back again with this next month. Tell everybody how they can reach you.
Yes. So call us at 210-767-9876. You can also go on our website, www.medicaregals-st.com.
Susan, you're the best. If you're in the San Antonio or actually, if you listen to us anywhere in Texas today, but we mostly promote this in San Antonio, please give Susan a call. Don't do what I did the first time and try to do it yourself. Susan, thank you so much, and we'll see you next month. And hey,
Sounds good.
I would tell you to stay busy, but I don't have to do that.
Phones are
Take
ringing.
care.
Bye.
Thanks, Susan. That's Susan Shimp. Uh, Folks, if you're in the San Antonio area, please give her a call. If you're getting ready to go on Medicare or you're on Medicare and you need to check your policy, give her a call. Hey, that's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.